for giving me the opportunity and welcome everybody this evening. Yes, as she said, the class is in 2 weeks at Barton. I believe it's in the conference room there at the fancy new building. So I just want to talk a little bit about mental health first aid tonight and why it's important. So I'm sure all of you have probably been under a bit more stress in the last 3 years than you were before. Just as a reminder, we're still in a pandemic, and let's see, we have a current raging fire in El Dorado County, at least one. So there's been a lot more reasons to be stressed out. And so one of the things I want to talk a little bit about tonight, in addition to mental health, is suicide, because it's Suicide Prevention Month. And I believe, as it says on the slide, that everyone has a role, or because of this graphic, a piece of the puzzle in helping to stop suicide, and mental health is first certainly on people's top of mind. Suicide is everyone's business, I believe, and so is really mental health. Just like we talk about physical health and wellness, we need to talk about mental health and wellness. So that's a little bit about what the mental health first aid class is, and I'm going to just dive right in. So what is mental health first aid? Mental health first aid is the help given by a lay person. So anyone over the age of 18 can attend this class. Well, technically over 17, I guess, because then you'd be 18. So anyone can help anyone else who's having a mental health problem or a mental health crisis until help arrives, professional help arrives, or a crisis team arrives, or until the crisis resolves on its own. So it's very simple to learn. I'm sure some of you have taken a regular, I'll call it a regular first aid or CPR class, where you learn how to do chest compressions and help with bleeding and help keep someone alive that way. Well, taking it one step further, if you do mental health first aid on someone, you may keep them alive as well. So that's one of the things about mental health first aid. So how is it different and similar to mental health first aid training? Well, you both are keeping someone alive. In mental health first aid, it's less about putting your hands on wounds or doing compressions on people's chests or doing mouth-to-mouth breathing or something like that, or putting your hand on someone who's bleeding. It's more about using your voice and your talking skills to get someone to help them through, talk them through the situation. The other thing that you need to do a lot is listen. Listening non-judgmentally is probably the biggest thing you can do to help someone. Because sometimes, and you might be thinking about this for yourself, sometimes when we're having a mental health issue, we just need someone to listen for a minute. We don't necessarily need anybody to fix it. We just need someone to talk to for a little while. So anyway, that's a little bit about how it's different than mental health first aid, or regular first aid, I should say. It's similar in that, just like we used to have, I think it was ABC, airway, breathing, and compressions. And now for those of you who are newly certified in CPR, it's now CAB, so compressions, airway, and breathing. We have an acronym in mental health first aid to help you remember all of the steps that we give you during the class, so that you'll know how to approach someone and what to say when someone tells you, hey, I've been depressed for a little while, or hey, I'm having some anxiety, or maybe I'm having a panic attack, or maybe I have some unresolved trauma and I was just reminded of it, so I have a little post-traumatic stress. So let's talk for a second about some signs and symptoms. So hopefully all of you can recognize a sign would be something we can see, like stop signs. Kind of noticeable, that's a sign. So a sign when someone is maybe not feeling perfectly great would be crying. You can visibly see crying, or you might see red eyes if someone's using substances, or maybe someone just looks really sad, or maybe someone's wringing their hands a lot. So those are all signs. Symptoms are things that we feel and you don't necessarily see. So the example I like to give in class is, you can see when someone's pregnant when they're very far along, but you can't ever see nausea unless, of course, it turns into vomit. Then you see that sign, but you can't see symptoms. You only feel symptoms internally. So that's a little bit about signs and symptoms. So one of the things that's important to remember, like around depression, which is of course a huge risk factor in suicide, are things like, well, and let me get through my slides here for a second. So let me just say that suicide is not something most people want to talk about because it makes them uncomfortable. And there's lots of stigma around not just mental health, but especially around suicide deaths and attempts. And mental illness is still not something we discuss. We don't post about it typically on Facebook, Twitter, Instagram, all the other social media outlets that people have now. We tend to not talk about mental health, kind of the same way we didn't used to talk about cancer back in the 70s when people would say, oh, so-and-so has the C. And you were like, well, what, the C, the cancer? Oh no, I don't want to. And it was almost like if you talked about it, you'd catch it. And I feel like we're kind of there a little bit with mental health today. People don't want to talk about mental health because it might be catching. Well, unfortunately, or fortunately, it's something that is pretty much in everyone's family. I would say on average, the statistics show that about 1 in 4, 1 in 5 of us in any given year have a mental health issue or a mental health crisis. And so if it's not me this year, it might be you. If it's not you next year or this year, it's going to be your next door neighbor. And yet we still don't talk about it as readily as we do cancer diagnoses, or I broke my leg, or I cut my foot, or what have you. There's still a lot of stigma around mental health issues, and suicide is take that a level up. So let's see, what do you learn in the trainings? Oh, well, let me go back to some depression. So depression is, again, one of the biggest risks for depression is suicide. And because it's Suicide Prevention Month, I just want to bring these to your attention. So some statistics. So in the United States, suicide is a leading cause of death. It's one of the leading causes of death for adults, and it is one of the leading causes of death for kids aged 10 to 25 as well. Well, that spills into transition age youth up to 25 as well. Nationally, it's about 14 people per 100,000. In California, because we live in a fairly calm weather state and a fairly affluent state, it's about 10 per 100,000. And then in El Dorado County, we're at 17 per 100,000. So we lose about 34, 35 people every year in El Dorado County. And then for each death by suicide, about 135 other people are impacted. So that's family, friends, coworkers, neighbors, people they sat with at church, people that they saw at the grocery checkout line, etc. And of course, that number goes up or down depending on how prominent that person was or how large that family was. For example, I have 10 first cousins. They're all married. They all have kids. So I have a huge family. But not everyone has a family of that size. But certainly if I were to die by suicide, there would be a ton of people that would be concerned. And I'm fairly well known on the West Slope, less so in Tahoe, but it would certainly impact many people were I to die by suicide. One thing I want to say about suicide here while we're talking about it is some of the warning signs would be things like talking, writing, posting about social media, about death or dying, obviously, or feeling hopeless or helpless, feeling trapped, seeking access to means. So trying to figure out where you can get the tools you'd want to use to attempt to die by suicide. Giving away prized possessions would be another thing. Kind of cleaning up your room or your house and making things in order so that when you die by suicide, there's less sort of cleanup to happen as far as your financial affairs and taking care of, who's going to feed the cat or whatever. Redoing a will or making a will out for the first time might be a warning sign for people. A sudden change in mood. So if someone's been depressed for a really long time and now suddenly they seem like they're much better and happier. That could be a warning sign. Maybe they found the perfect therapist, and maybe they didn't find the perfect therapist, and they've decided on a plan, and they've decided when and where they would do it. A few of the other warning signs might be seeking revenge on people. It's kind of about tying up loose ends with folks. If I'm not going to be here, I don't want you to be here either. What else? Well, having a plan certainly is one. Having another mental illness or having a chronic physical illness can be a warning sign for suicide. Withdrawing from family, friends, and social groups. And I'm not talking about falling off Facebook, because sometimes that can be very healthy, but if people just stop posting on social media altogether, that might be a warning sign. Another one is increased drug or alcohol use, or starting to use drugs and alcohol, because of the risk factor in that it lessens your inhibitions and it increases your willingness to take risks. People that have less social support. So think about how many seniors we have living in our county that may be geographically isolated from family and friends. Maybe they don't drive anymore, so it's harder for them to get out. And then our lesbian, gay, bisexual, transgender, and questioning kids that are in like a foster care situation, because if you can't come out to your parents and be safe, or your family and be safe, and now you're in foster care, how are you going to tell a foster parent that you're identifying as LGBTQIA? So that's another huge one. Being really agitated is another warning sign of suicide. And some of these are also signs that someone is depressed as well, right? Depression is definitely a part of being suicidal. All righty. Let's go on to, let's go on to how to help. Well, we talked about that a little bit. So I talked about warning signs and symptoms. So how can you help? So on the next slide, I'm going to give you a bunch of contact information, and feel free to take a screenshot of this. So the most important thing you can do, as I said earlier, is, realize that someone is depressed or in need of some mental health help, and provide them information. And I'm not talking about information when you give them advice like you should do something, because adults don't like to be should on. We don't like to be told what to do. We sometimes dig our heels in, but providing them information is different. So giving them a phone number and saying something like, they might be able to help you, is way different than you should call this number, you're crazy. And then providing some empathy. You might not be able to understand what they're going through, but you can certainly see that the person is in pain or struggling or upset, or any of those other adjectives that you can think of to describe someone who might be having a mental health crisis. So you can certainly provide information and some empathy. And empathy and sympathy are not the same. Sympathy is, oh, poor you. And empathy is, I really feel for you right now because I can see how distressed you are. So there's the text crisis number that's 741-741. There's the new 988 number that's replacing the long 800-273-8255 talk number. 988 is actually a text line. It's so you can text it, you can call it, and someone actually talks to you on the phone. So it's easy to do without everybody in the house hearing you, because you can chat just like the 741 number. And then there's the Trevor number for lesbian, gay, bisexual, transgender, questioning, all the other initials that go with that. Youth for 818-66488-7386. And then there's the El Dorado County South Lake Tahoe mental health crisis number. And then there's the Placerville crisis number, which I included just because I'm over here on the West Slope. So I'll keep that slide up there for a few minutes. All righty. So why is mental health first aid a thing? Well, because most people don't know what to do when there's a mental health situation. The way that I usually explain it is, if you go to the grocery store and get a sympathy card because someone has died, there's usually a ton of text in that card, and there's just space to write your name, because most of us don't really know what to do when someone dies. And we're not very good about talking about feelings around depression and anxiety with other people. That's why in this country, therapy for many people is still a dirty word, because we don't like to talk about it. So there's certainly a need for this kind of help. I'm sure all of you are familiar with, well, maybe some of you aren't, but there's a recent trend going on in the workplace called quiet quitting, where people are maybe doing not necessarily less, but doing the bare minimum now to get paid. And I think it speaks to the layers of stress that we've all been under with all of the things that have happened. I mean, keep in mind that it's been 21 years since 9/11, and we've been at war essentially that entire time. We now have this pandemic. We have the added, health issue of monkeypox now. We currently in basically the entire West have climate change and impacting more fires. There are more reasons to be stressed out. Some of the other reasons to be stressed out are the recent presidential election. It doesn't matter which way you voted. The fact that we had an insurrection on January 6th last year and our democracy was threatened was certainly impactful for people. We were just headed out of or into a pretty major race issue back when COVID started, and that kind of tamped things down a little bit. But if any of you think that race is still not a stressor for people, all you have to do is look at some of the postings about the latest Little Mermaid and the fury over Halle Berry playing Ariel. This is a cartoon character we're talking about, right? A fictitious character. There's also been a lot of backlash I've seen online about having African-American actors in the new Lord of the Rings series. So there's still race issues to be concerned about. There's elections to be concerned about. There's still COVID to be concerned about. School just started up, so some of you may have kids in school that are stressed out about things. So there's a lot of reasons, and yet we really still don't do a very good job of reaching out and helping other people. I'm sure some of you can relate to the idea that you're always very willing to help others, but if you stop and think about it, you may not be so good about asking for help yourself. And I'm going to say something like, if any of you have ever tried to move a couch, you're like, oh, I got this. And then you try to move the couch and you either hurt the couch, as in you rip some of the cushions or the fabric, or you hurt your back because you didn't want to ask for help with that. It's the same thing with our mental health in a lot of ways. We tend to think in our Puritan society that you are weak somehow if you need help with something. And I would suggest that the opposite is true. It is a sign of great strength to ask someone for help. Knowing when you can't do it yourself makes you a smarter, more emotionally intelligent person than someone who just struggles along and doesn't reach out. So there's a lot of crisis numbers to reach out to. At the end of the presentation, I believe we have a couple more for you as well. And it truly is a life skill to be able to reach out and help someone else. And let's face it, those of you who have been helpers in the past, it makes us feel good when we can help other people, generally speaking. It makes us feel better when we can reach out and extend a hand of friendship to someone else. And doing that with someone who's having a mental health need, even if you don't understand it, makes you feel better. So that's one of the things that you'll learn how to do, is to reach out and help someone else. So I want to talk a little bit about the mental health first aid class, specifically at Barton on September 29th. So some of the topics that are included are things like, we're going to cover anxiety, we're going to cover depression, we're going to cover non-suicidal self-injury, which some of you may know is like cutting and burning. We'll talk a little bit about that and the whys. We do talk a fair amount about suicide. We also talk about trauma. We also talk about psychosis, which is where reality is different for you than the rest of us. And we talk about substance use. Substance use is an interesting topic because I think some people are still in the mindset of, well, it's a choice to use. And it might have been a choice the first time they used, but that omits babies that were maybe born tox positive, or other people who maybe have been forced or otherwise coerced into using substances and are now addicted and cannot help it and now have a disorder. All right, let's see. So we also, of course, we talk a little bit about stigma. We still have a ways to go to accepting what is normal versus typical. I usually say normal is a setting on a dryer, and there's typical behavior that people exhibit. And that typical behavior, I think, is a little more forgiving of people's quirks and their own perhaps lens or way of that they were brought up. Why should people take mental health first aid training might be a question some of you have. I think mental health first aid training should be for everyone, because it is far more likely, frankly, that you're going to run into someone who is depressed, anxious, stressed out, or perhaps has had trauma, than you are going to find someone who's had a heart attack right in front of you and you need to do CPR on them. I can't tell you, because, you know, it's a small town, right? El Dorado County is not a very big place. So I can't tell you how many people have stopped me and said, oh, I'm so glad I took your mental health first aid training, because I used the skills that I learned a month later or 2 weeks later, or even a couple weeks ago, I taught a class for those who work with older adults, and the person used it the next day when they went to work. It just so happened. So being in the right place at the right time and having the skills, there's a lot to be said for that. My hope with this training is that more people feel comfortable talking about anxiety, depression, suicide, non-suicidal self-injury, trauma, psychosis, and substance use, and that we can reduce the stigma for those who live with mental health issues, whether their own or within their family. And that people who are considering taking their own lives by suicide think that, oh, maybe I could get help instead, because I feel like we can stop many, many more suicides than we currently are stopping, not just in El Dorado County, but basically in the United States as a whole. Let's see, and there is the flyer with, I think, correct me if I'm wrong, but is that link only for internal education.barton.org?
No, anybody can use that link. That link is also, I've posted it into the chat box, so anybody can click on that, and there's information on the course. And then to sign up, you'll contact Jenny. Her number is right there on the website or on the flyer.
Perfect. So the class itself is the 29th, and it's at, what does it say? Conference room C, and it's from 8 to 4:30. It is 8 hours of training. If you thought listening to me for the last 25 minutes was fun, you could listen to me for 8 hours. I think it's a great class, and I will be happy to field any questions now if there are any.
Yes, thank you so much, Stephanie. That was excellent. There are a few questions, and a reminder, if anybody has any more questions, you can use the Q&A box at the bottom of your Zoom screen. Let's see, the first one is, will there be more local trainings besides September 29th?
So I would be happy to do some more local trainings. I have been crossing my fingers that at some point Barton will have their own mental health first aid trainer there, because as some of you might imagine, it's a little scary for us Flatlanders side of the mountain people to come up and over between, I don't know, November and March sometimes, and sometimes that's really October through May. So I'd be delighted to come up more often, but weather definitely does play a part, and it does make for a very long day for us. So I'm hoping that Barton someday has their own mental health first aid instruction. I see a question about virtual first aid instruction. Because of the nature of the topics around suicide in particular, we don't have a virtual training, just because it's a little it can be a little intense for people, and we don't want people to just be able to click off the computer and not know where they went and how they were mentally. So I'm not sure about physical limitations in the classroom. I believe the building is ADA compliant, but I must admit that I've only been there once, so I'm not really sure. And I think Barton is still probably taking precautions as far as masking. Yes.
Yes, that is correct.
Yes.
So. Yeah, great point about the winter travel. And looks like the next question is similar to the last one, but this person asks, are there any other ways that they can get involved?
So other ways to get involved. So I do want to mention that there's a couple different versions of this class. So there's the adult version, which I'll be teaching along with my coworker on the 29th. And then there's a version for those who work with veterans, which is probably a fairly small group up there, and as far as working with them, but it's also family members of veterans. And we've never taught that version up there. There's also a version for those who work with older adults, and there's one for those who work with kids, which is a pretty broad category because working with kids could just mean that you have kids, right? So that's another class that at some point I would love to teach up at Barton. A couple other places you can go for more information in addition to Barton are the El Dorado County website has some information on behavioral health, as does the NAMI Eldorado County.org site. And NAMI is the National Alliance on Mental Illness. And we have a very active chapter of folks in NAMI in El Dorado County, and some of them are, yes, in Tahoe. I believe they're meeting via Zoom monthly, but they also offer family classes for those who have family members who live with mental illness. And it's a little more in depth as far as what to do if your loved one winds up in the psychiatric facility, or what to do when your loved one gets a diagnosis of X, Y, or Z. So it's a little more specific. Mental health first aid is a broad topic. As I said, anyone can take it as long as you're over 17. So 18 and up can take it. I've had every age from literally 18 birthday yesterday to someone who was, I think I had an 86-year-old in a class once. So, and I see someone wishes the class was on Mondays. I wouldn't preclude that it would ever be on a Monday. Mondays can be hard because a lot of people, I think, forget that, oh crap, I had a class scheduled on Monday and I forgot all about it. So I actually try not to schedule them on Mondays, but if we had enough clamoring for a Monday class, I wouldn't be opposed to a Monday. And I'm not sure if I can see any other questions in the chat. Oh, let's see. What resources are available? Oh, and working in a call center on this topic. Well, it would depend on the specific type of call center it was. And I would say some of your best friends in a call center would be referring them to the chat number and staying on the phone with them so that they could chat and talk to you at the same time. Because certainly if someone is suicidal, you don't want to leave them alone. And it's very difficult to read people's body language on the phone, which is another reason we don't do the class virtually.
Excellent. Another question, how do I encourage a friend to use the 988 number?
I would tell them, I would say something like, I mean, it's hard because I don't know your relationship with the person, but if it were me and it was my friend, I would say, I can see you're struggling and I'm not the expert in this topic. What if we called the 988 number together? Because I feel like we need some help to deal with this, and I'm happy to walk on this path with you, but I don't know what I'm doing, and let me help you by helping you dial this phone.
Excellent. So I have one more question, and that is, which I believe you kind of answered, but is the course lecture format or a workshop format?
It's a mixture of lecture and work. What did you say? Workshop. It's a mixture of lecture and workshop. It's a presentation of slides, videos, and we have a lot of interactive exercises. So The class is never the same, which is another reason it's not on video, because otherwise you could just press play and watch me do it. But whatever people bring to the class is kind of what we wind up talking about a little bit more in depth.
Excellent. Thank you so much. Well, Stephanie, thank you so much for your time, and thanks to all the participants for joining this webinar. As a reminder, we do record these webinars, so you can view them on our Facebook page or on our YouTube page, youtube.com/Barton Health. And once this webinar concludes, you'll be asked to take a quick survey, and we really appreciate hearing your feedback and giving any ideas on future topics for us to cover. So you get about a half hour of your evening back. Unless you have anything more to add, Stephanie, I'll let you all go.
And I was just going to say thank you so much for setting this up, Barton, and I hope that I get to meet some of you in class. Gosh, 2 weeks from today, right? Yeah, 2 weeks from today. So I look forward to delivering the whole curriculum then, and hopefully we can maybe set up a youth class at some point. Thank you.
Great. Thank you so much, Stephanie. Have a great night, everybody.